the time there in Paris.
Yes.
So hi, good morning, everyone. Welcome to 104th non-stop weekly session by Confederation of Medical Association of Asia and Oceania, and with all other countries joining in together. We are live every Saturday, 9:30 a.m. Indian Standard Time. We are also live in a lot of countries. So depending on which country you are, there is somewhere in afternoon, somewhere evening, and somewhere night. We are here for discussion. This has been ongoing for last 2 years now, and our purpose is to bring what's going on in around the CMAAO countries and some of the European and American countries. We discuss what's going on, we make our conclusions, and it helps the entire world. With this note, we will start the meeting, and I would like to welcome our chair, Dr. Chong, who is sick, but has a smile on his face, and all other medical associations over here joining in. So we will start with Dr. Chong. He is a chair for CMAAO and from Singapore Medical Association. So Dr. Chong, would you like to tell what is going on with you and in Singapore and COVID with dengue?
Thank you, Saurabh, and great to have everyone here today. Sorry, just recovered from my COVID plus dengue episode. So it's been quite a trying 1 week, down about 3 kilograms, and was virtually, in bed the whole week, couldn't get out of bed. So quite deconditioned. But yeah, we're having a big dengue outbreak here in Singapore. I think it's since the beginning of the year, which is really, I think, just around March. We have about 400-500 cases already. In my area alone, where I live, I think there's about 200 cases. Half of it is in this area here. So unfortunately, I picked up dengue together with COVID on Saturday. And my son's also down with dengue. So yeah. So as I was telling Dr. Jamal just now that although Singapore in the 70s had one of the best mosquito eradication programs in the world, we got rid of malaria, by the way, in Singapore. And we continue to be very, very good at it. However, I spoke to our person from the National Environment Agency, because they call you whenever you get dengue. They call you and ask you more questions. So they say that even despite all the steps and all the advertisements and all the push and so on, there's still a lot of breeding going on in homes. Every time they go through the community, they find there's breeding happening in the homes. So apparently they just believe that it's not the effort is there by the community, but it's just not sustained enough. And another interesting thing is, some years ago, I remember listening to a talk here by this quite some years ago. I don't know what became of this research, but at one point in time, our Institute of Molecular Biology was collecting all the blood from all dengue patients in Singapore. Every time there's a dengue patient, you can send a blood sample to them. They'll collect it for research purposes and so on. And I remember one presentation he gave me where they kind of look at the genomic studies of every single dengue patient and where they caught dengue, what time, which day, and so on. And they found, very interestingly enough, that there's some evidence, of course, I don't know what happened to that work, that the virus may transmit from mosquito to egg. That means intergenerational spread of the virus. Because what we think is that, you have to bite the person with the dengue, then you bite another person without dengue and transmit it. But there seemed to be some evidence to suggest that the mosquito could pass the virus onto the egg and the larvae. I don't know what happened to that data. It'll be interesting but this is, of course, many, many years ago. So we continue to struggle with it. And every time it's always a change of the monsoon, when there's, because recently in March, we have the change of the monsoon. So now we have the sun followed by the rain the next day, alternating rain, sun. It's just a recipe for disaster. So that's what's happening with the dengue situation in Singapore. I think the year before, in 2020, there were more deaths from dengue than COVID in Singapore. Yeah, of course, we were in lockdown, so there were very few COVID cases, but there were more deaths from dengue than COVID in Singapore in 2020. COVID situation is now coming down very nicely. We have about 5,000 cases a day. At a peak was 30,000. So we're now coming down nicely. Hospitalization remains all right. ICU numbers are okay. Mortality, about 1,260 cases from COVID so far in 2 years. Still very unfortunate, one too many deaths, but still, I think still at a very manageable process, and ICUs are not full at all, and so on. So that's what I've got to report from Singapore. Thank you.
Dr. Chong, actually just a question. What about the vaccine actually they are trying for dengue?
Oh, okay. So in Singapore, for example, the Denvexia is available, but our criteria here in Singapore is that we only give it to people who have had one attack before. That means we do not give it to dengue naive patients, because there's worry that if you give it to a dengue naive patient, the first attack will be actually far worse. So that's the thinking here in Singapore. Usually we give it 6 months after the dengue attack. So I will probably get mine 6 months later. Yeah, make sure the next attack won't be worse, because you know how it is, right? The second attack is always worse.
Dr. Chong, I have a question here.
Sure.
There are a lot of, this is the first time we are seeing a severe disease, which is like a COVID, which has been a life-threatening disease forever for people. Obviously now there's a vaccination, there's a mild going on. And then there's a dengue, which is very severe for you. Is there any extra precautions which you have taken, and was there any medication which you were avoiding because both the symptoms COVID and dengue was together, and any other things which our audience needs to know, or somebody like that?
Well, I tell you, when I was diagnosed with both, I was kind of worried, because it's not exactly a friendly combination.
Yeah.
So yeah, so I was taking the first couple of days before I received my diagnosis of dengue, I was taking Acoxia, for the body ache and all that. It worked beautifully. Then after a while, I said, once I was diagnosed with dengue, I said I better stop the Acoxia, because I'm kind of worried about all these NSAIDs in dengue, increased bleeding tendency and so on. Yeah, pretty much nothing. Just drank lots and lots of fluids, isotonic drinks. And even despite 3-4 liters a day of water and isotonic drinks, my hematocrit started going up from 49% to 50%, and the last one was 51%. So today I'll see what my hematocrit is. But despite 3-4 liters a day, it's still, So at one point in time, I was deliberating whether to ask my girls to set up a drip for me, or go to the hospital and get a drip done. Yeah, because hemo concentration is something we worried about, especially now in view of the Veterans Administration data, which is quite frightening. You recall the Vet Administration's data. It's 150,000 veterans in the United States post-COVID out for 1 year. They found that the number of MIs increased by 63%, number of strokes by 52%, and arrhythmias 71 to 84%, AFib to ventricular tachycardia, pulmonary embolism 300%, deep vein thrombosis 200%. So the cardiovascular toll on COVID actually is very, very large. And with dengue, with the hemo concentration and all that stuff, right, you get really very worried about cardiovascular thrombosis and so on. That's my thinking. Yeah, so I'm pumping myself full of water and isotonic drinks.
So good that you have just avoided any side early. Otherwise, you would have a problem. Actually, it's good.
Yeah, nasty.
The combination of dengue.
Yeah, nasty combo. I wouldn't wish it on anybody.
You're not thinking that you're having that both together. So you took NSAID, huh? But
Yeah,
actually,
initially I mean, I didn't think it, I didn't think it was, dengue. Dengue, I wouldn't take NSAID.
So how you suspected that you are having you also dengue also?
Oh, because
So
my son
and gone
got,
for the test. Oh,
because
your son got.
my son got the dengue. Then he was
Oh.
ART negative. He had high fever. He had ART negative. So I got him
You
to go
went
to the
for check.
hospital to check,
Mm.
and then they found dengue. So I suspect I had it because 2 days later I turned all red. So that's when I knew I.
Oh, God save. Good. Yeah, God
No fun.
saved.
No fun.
Yeah, that's good.
No fun at all.
Dr. Chong, your platelet, you mentioned it was low. So how low it went and how it came up, how long?
My first platelet on diagnosis on the Tuesday, that was last Tuesday, was 91,000, 91. So 91,000, we call it 91. So at 91, then 2 days later, it dropped to 56. And then another 1 day later, I did it. The next day, it went up to 57. So today, I'm waiting for my platelets to come back. But it seemed to have turned the corner. And my total white has dropped from 1.6 to 1.7. And the latest is gone up to 2.1. So I think it's okay. I think once the whites and plate turn the corner and the platelets start to turn the corner, it's okay. So I feel better. But this morning when they drew my blood, it was still rather viscous. So I think there's still quite a lot of hemoconcentration, a lot of third spacing, shifting. My prothrombin and PTT time are all normal. So that's okay. Liver enzyme slightly up, about 130, 140 for GGT. The rest about 80, 90. So expected some liver dysfunction. Otherwise, yeah. Sodium was normal all throughout. So very worried about sodium. One of our predictors of bad dengue is always a low sodium, prolonged PTT, hematocrit. These are the ones we always are very, very worried about. Yeah. Thank you, Dr. Akhtar. Thank you, Dr. Akhtar, for the best wishes.
Yeah, thank you.
Dr. Kuzi, you have something to ask me?
Yeah.
Yes, thank you so much. Very interesting.
Dr. Chong is a birthday boy today.
Dr. Chang, I just need to understand, please excuse my ignorance. Why do you immunize someone after they had dengue fever? Why would you vaccinate them? And the second question would be, don't you get antibodies so that next time when you're bitten by the mosquito, would you then be protected or not? And my third one is just an observation. I think this winter in South Africa, we are going to have a difficult respiratory tract infection winter with COVID-related cases, as people are not wearing their mask anymore. I think we're going to see exactly what happened to you. Stuff like RSV, Haemophilus influenza, all combined with COVID. So I think we're going to get very, very sick people going into this winter. And I'm not sure whether we are really equipped enough to make two diagnoses. So I'm just, what happened to you, I think it is something that's going to become more common in future. Thanks.
Yeah. So yeah, it's you asked very good questions actually. So the original Denvexia made by Sanofi, the original trial, I think in the Philippines, what they found was that there was when they did the vaccine on, I believe, children. You can go Google up the trial. They found that there was antibody dependent enhancement. So this is where the vaccine actually, by giving the vaccine to naive patients who never had dengue before, when they had the first attack, it was more severe because somehow the antibodies induced by the Denvexia vaccine kind of has this antibody enhancement effect. Okay, essentially, to put it simplistically, I think what happens is that the vaccine induced antibodies, and Monica, if she's around, can tell us a little bit more about this. but the vaccine-induced antibodies somehow hide the fact that your the virus has entered your body and hides it from your body's immune system. So they ended up getting more severe dengue for the first time after the vaccine. So as a result, we do not give the vaccine to naive patients. We only give it to patients who had first attack of dengue. And that's the reason behind it. So you can go Google that trial. The vaccine is called Denvexia, Dengvaxia. It's by Sanofi. And that's the reason. So in Singapore, we do the vaccine 6 months after you get your dengue.
So, Dr. Chong, another question I have: what is the risk of spreading COVID once you have a COVID and the mosquito, like dengue is because of the mosquito, and then he's spreading the COVID? Is there any research on it from like Singapore? Like I don't know whether this is a valid question or not, but I was just thinking, you have COVID, and then let's say you have dengue because of the mosquito bite, and the same mosquito is going around everywhere.
I don't believe there's any evidence that COVID is spread by the vector. I don't believe there's any evidence. But interestingly, you asked a very good question about this vector. So in Singapore, we have the mosquito, right? The Aedes mosquito. Now, it's very interesting. So this same Aedes mosquito technically can spread other viruses which are carried by mosquitoes, right? So we get chikungunya. So we got chikungunya because some of our foreign migrant workers brought chikungunya from India and places like that, and our mosquito bit them, and we have transmission of chikungunya in Singapore. With the same token, it's very interesting. Technically, we can have yellow fever from Brazil. So when we had the first flights from Singapore Airlines flying directly to Brazil, to I think Sao Paulo, one of the conditions which the airlines was very, very careful about was that anybody taking this direct flight must have the yellow fever vaccine. They were very, very cautious about that because technically we have the vector here. So a foreign imported virus can come into our mosquito population and spread the disease. Interesting, huh? So that's yeah. So that was something we were very worried about. Yeah, in today's world of international travel, this is something you have to remember.
Okay. Yeah, Dr. Wazi, you are asking something, and then we will like to go to Dr. Russell D'Souza. He's another patient here. I see he's also, I think, having a lot of fatigue. He also had COVID while traveling. So we'll come to Russell. Meanwhile, Dr. Wazi, can you ask your question?
Oh, it's not a question, but I would like to, express my feelings. It's really good to see Chong smiling and back with all the energy, and that's really great. My question to Chong is, it's a small question that we saw a video regarding the genetically engineered mosquitoes being released to curtail the population of mosquito in Singapore. Is there any update that how that worked?
Yes, thank you very much. Yes, we have this Wolbachia. I think the name is very funny name, Wolbachia. It's actually, I think a lot of work was done in Australia, if I'm not mistaken. Maybe Russell can tell us a bit about that too, if he knows. Wolbachia is actually, I can't remember exactly how it works, but it was introduced into our local population of mosquitoes. And it actually can stop the transmission of dengue in Singapore. But so far, I haven't heard any news from it. I think they started doing this trial of introducing Wolbachia into our local population. If I'm not mistaken, it is the male mosquito that carries Wolbachia. Later, I'll find some data about it. I'll post it on our group chat. So it is a male mosquito that is harboring this bug called this bacteria. I can't remember it's a bacteria or maybe it's a bacteria. And this Wolbachia is actually mates with the female mosquitoes, and then results in them not being able to transmit dengue and so on. So yes, you've asked a very interesting question, but I don't know how successful the Wolbachia trials are yet in Singapore. I'll find out more data for you.
Yeah.
Thank you, Dr. Chong. We'll give you a break, take some rest right now, and I'll call you back. We will go to Dr. Russell D'Souza. Dr. Russell, would you like to share what's going on with you?
Yes, thank you. Thank you. Thank you, Sir Saurabh. I think last time I just did say I returned from Scotland and London and Porto, and of course came back here and I was positive. And so fortunately, as I said, the vaccine seemed to have helped. So it was not, I didn't get as bad, too bad. And the other issue was, I don't know too much about, I do know about the genetically modified mosquito, because in Australia, of course, we have the Aedes, but we have the Ross River virus. But for the yellow, we can't, you must have the vaccine, like you said. If you go not to any of the Latin American countries or anywhere in South America and even Africa, you must have that yellow fever. But we do have a Ross River virus. But in the last few weeks, we have had 5 cases of Japanese encephalitis. That has come. But otherwise, everything else seems to be coming. We continue to have cases, like the cases are there every day, but there has been no impact on the hospitalization. And pretty much Melbourne and Victoria and New South Wales seem to be the main 2 places that still has, but it doesn't have, there's no increase or really no effect on the hospitalization, which I think the important part here is that we have a big program doing the 3 to 5 or whatever the vaccine. So those in school. So they're doing that now. And of course, as I said last week, they've now made the 4th dose available or recommended, that we have the 4th dose for people of 60 years and above, and of course all those are working in aged care and so forth. As Angelique will know, we are both going into winter, so they expect as opposed to the northern hemisphere. So we have expecting a large flu, because for 2 years we have had no flu at all. Probably because of the lockdowns, probably because of the masks, and now of course they've relaxed all these rules, except for the primary school, because they haven't yet had their 2nd dose. So what's happened is that we have a massive influenza vaccine program now. So I had my shot yesterday or day before yesterday. So all of us, everyone's getting. They're wanting everyone to get the flu before it comes in. We expect probably somewhere in the end of this month or so, or the beginning of May, that there'll be a flu. But the only concern has been these 3 in terms of 4 or 5 cases sporadically I think it was Queensland, on the Japanese encephalitis, but they've sort of working on, they've identified and things are happening there. And the other, and of course, Dr. Chong, you'll be happy to know that from I think 18th of this month, Australia has stopping all the requirements for testing when you come into the country. I think I just had to do like everyone. Australia and Singapore is the other one that require negative COVID test to enter to get on the flight to come here. But from the 18th of this month, I think they are removing all that. So other than the need for a vaccine, they're opening up everything, just like probably most of the other countries. So that's one of the. I guess what's happening is there's a far more. Everyone's trying to become normal. Everything has come back. People are asked to come back to the. People are started returning. The CBDs is again back. People are back in offices, or 50% or so, and they hope that they want everyone to come back and start, going as normal. That's the way it is. Yeah, I am in Sydney at the moment, so came for a meeting. So it seems to be the travel now is, we come from in Australia. We had major lockdowns. Probably Melbourne was the most lockdown in the world. So for us, even traveling to another state was a great thing. So everything's now opened up and things seem to be coming back to normal. So the testing, having a negative PCR when you come into Australia is being removed from the 18th of this month. That's where we are. So things are pretty much, cases are there, but seems to be masks have been removed except for primary school and transport and in hospitals and aged care settings and public transport. Yeah, that's the only time you have to wear it. Thank you for that. But I'm much better. Still a little tired, but other than that, probably from my age too.
And have you lost weight, Dr. Russell?
No, not yet. I don't think I have, but as I've not had the Dr. Chong's. He already was very thin anyhow. But anyhow, I haven't lost that much of weight. But I'm on the 8th. After going and coming back, I've got some courage. So on the 8th, I actually go to London and to Amsterdam and all that for about 10 days. So I'm looking to see what's the changes coming on there.
Thank you.
Thank you very much.
Can I invite Dr. Marie from Japan?
Thank you very much. I'm very happy to see the Dr. Chun smiles again. And we are celebrating now the cherry blossom seasons. Can you see the cherry blossoms are blooming right now?
I already saw that while you opened the camera. It looks beautiful.
Thank you. And we are experiencing a shifting from BA1 to BA2. And it seems like there are no severe patients at all. So we are kind of open the cities, no restriction at all, but almost everybody wearing the masks still. So we can, we have to watch what will happen with BA2. Thank you very much for every week. Thanks a lot.
Thank you, Dr. Marie. That was Japan. Can I invite Philippines Medical Association, Dr. Benito?
Good morning to all of you. Good evening to others. Here in the Philippines, it's already 12:36. Here in the Philippines, we are so lucky that we have the one of the lowest cases of COVID-19 for almost 1.5 now. Our reporting for our COVID-19 is on weekly basis. For the last week, we have about 4,000 to 5,000 cases, meaning there are less than 1,000 cases or less than 300 to 500 cases per day. And as of now, the Philippine government is still and the Department of Health is still strictly encouraging our people to have the minimum protocol. Wearing of mask is a must. Then social distancing is still there. However, in our transportation is not observed already. Then we are not strict in our quarantine and isolation requirement. After if you have symptoms, you must isolate. Then if you don't have, you have to quarantine at least 5 days from travel. And as of now, we have vaccinated almost 70 million with two doses, and we are now encouraging our 5 to 18 5 to 17 years old to be vaccinated. And for the 5 to 11, we only give them the Pfizer vaccine. It's the only vaccine with EUA. However, another vaccine is now available for vaccination, the Sinovac for 5 to 11, and we need to vaccinate. We are now encouraging our different of the society to have their boosters. As of now, we have given 13 million doses for boosters, and we need to give boosters for more than 50 million of our total population. And as of now, we are there are studying that we will give the second booster for the senior citizen and for the immunocompromised population. And we are glad that we have one of the lowest cases of COVID-19 in our region. And it's one issue is that we have different vaccines. At least we have given 8 to 9 types of vaccine, the mRNA and the traditional one like the Sinovac. And we are having we have lots of stock of vaccine. About 80 million are still with us, and we need to dispose those vaccines because of some of them will expire this April, May, and June. That's all.
Thank you, Dr. Benito for Philippines Medical Association. Can I invite Dr. Matanda Pillai? I think there is some interesting news coming up from India, is that India has completely removed the COVID restrictions, and surprisingly, a lot of states have also removed the masking requirement. So I will invite our Honorable Dr. Pillai to throw some light on it and give some update.
Thank you. As you rightly said, the situation in India is very much it is very much under control, and now the number of cases are hardly 1,260 to that range in the whole country. That means the positivity rate, the positivity is about 0.22% when you compare the total cases in the world. Our incidence is almost 0.22%. And even the RT-PCR positivity rate is again more or less at that range. 0.2 is the RT-PCR positivity rate. And all the restrictions have been removed. Now the schools are open. You can go to any restaurant. Travel industry is picking up very fast, and it's becoming much more crowded. Public gathering, the number restriction no longer exists. Even the mask and sanitization, some of the states even have made it optional, to the extent that if you feel you want to wear a mask, you can wear it, at least in Maharashtra and Delhi. These two states, even the mask and hand sanitation, it's not compulsory. It is left to the choice. But then the medical profession and the experts feel that such relaxation at this stage is too early, and at least mask and sanitation has to continue. And if you look at our total number of cases over the years, right from the time we had the first case of corona, It is almost 4.3 crores of population have been infected, and the death rate is almost 4 lakhs. So that's where we stand when you look at the total figure. And this immunization drive still goes on, and almost 167 crore population, not population, doses have been given in India. The third dose or booster dose, definitely, the emphasis is definitely there. And many of the virology institute studies show that a booster dose definitely helps in warding off infection, or even if you get the infection, it will be mild. So the immunization program, vaccination definitely continues. But even the biotech and other major manufacturers have stepped down manufacturing of the vaccine because the demand definitely is coming down. Even the pediatric age group vaccination process is going on, but it's not that vigorous. So that is where we stand. Almost COVID is under control, and even it can more or less say that it's only an epidemic. In certain pockets, in certain states, you have number. It's not distributed all over. But the medical profession is still cautious and say that basic precautions like wearing the mask and hand sanitation has to continue. That's where we stand. Thank you.
Thank you, Dr. Pillai.
Can I ask you, Dr. Markender, what about travel? Do you still, are they still wanting a negative PCR when you come in there, or what? I'm coming in June, so I was trying to find this out.
Yeah,
what's the latest?
The government of India does not put any restrictions. The RT-PCR is not done on those who land in our country. So even travel restrictions are no longer exist. But then it is better that you carry your vaccination certificate regarding the first and second dose or booster dose.
What about
from the government side? There is no restriction.
Right. So when I come in the immigration, they will not ask for a negative PCR.
Yeah, no need for RT-PCR and no isolation or quarantine or any restrictions in your movement.
But I think, Dr. Pillai, do you need the vaccine pass? Vaccine pass. That means fully vaccinated certificate. To enter India.
Yeah,
to enter India.
Almost 90%.
No. People traveling to India. They need to get their own vaccination. This completion card.
That of course better that you carry it. It is not being insisted, but it is preferable that you have your vaccination card with you when you come.
So what about local flights? Do you need to show it when you're traveling interstate or locally? The vaccine?
Not at all. There is no restriction in even domestic travel. Even the certificate of vaccination is not insisted on. But it is always preferable that you have it with you.
Right. Okay. Thank you very much. Just one more thing to add, Saurabh. I forgot to bring in. I think last week, Moderna, they're going to manufacture it in Melbourne. They've signed the deal, and they've created that's going to be the vaccine, and that company they have signed everything and about to. I think it'll be starting shortly. So they'll be manufacturing the vaccine or the whole that technology using the mRNA one in Melbourne. So that was announced, and they had a function for that.
Okay.
That's it. Thank you.
Thank you so much. Can I invite South Africa? Dr. Angelique, Dr. Akhtar, Dr. Muskuo.
Good morning. Good morning, everyone. Saurabh. In South Africa, the situation is much better. It's improving every day. Our new cases, 1,692 last 24 hours. And the death rate is also very few now. Last 24 hours, we had 10 deaths. Total positive case so far reported 3.7 million positive and 3.6 million recovered so far. Our total death rate is just over 100,000 and average active cases now 12,500. So the recovery rate in South Africa is 97%. Average testing for the week, last 7 days is 23,000 plus cases and positive rate is 6.1%. Past 1 week, 1,926 people were admitted around the country of public and private hospital. We had 169 ICU cases and 61 patients were on the ventilation. And in our province in KwaZulu-Natal is 0 death, only 406 cases, new cases. Our ventilation, our vaccination is so far 33.8 million.
Okay.
Thank you, sir.
Thank you so much.
Thank
Dr.
you.
Hendrik,
If I
would you like
can-
to? Yeah.
Thanks. Again, I'm going to say I am worried about what's going to happen this winter. Although our cases, as Dr. Atkar said, is not that high, it's still about above 1,000. And if you're taking into consideration that more than 50% of patients will just have symptoms and not going and to get tested, so I think our actual numbers are higher. The government this week acknowledged that they underreported COVID deaths. So that's also interesting. That's something that we have said before, that they are underreporting, but they now acknowledged it. And we're going, well, on Wednesday, Tuesday, the 5th, they're supposed to stop the state of the disaster management. And they're trying to put certain regulations in place to give the Minister of Health more powers. There's still a period that we can comment on that, which we will do. So this is, you know, I just think that we will have to learn how to live with this virus, as we have said many times before. But mask wearing, especially the ones in that we as a medical professional, medical doctors are wearing, I think that should for each and every healthcare facility be mandatory, and people coming into a healthcare facility or a hospital, doesn't matter, or any place where there's other people that you are facing, should keep on wearing masks. I think we're going to make a huge mistake by abandoning masks in workplace and in you know, in certain facilities. I'm worried what's going to happen this winter. Thank you.
Thank you so much. Do we have Dr. Mukswa? I think he's left. Okay. Dr. Ravi, would you like to take forward?
Yeah, thank you, Saurabh. Firstly, I would like to wish Dr. Chong and Dr. Russell all the best. It's good that they have come out, and it's a pleasure to see them with us now. In fact, Dr. Chong was having a major double whammy, which was a bit worrying, but glad that they're out of it. Well, in Malaysia, what's happened now is we have come down to about 18,000 cases daily. 99% are category 1 and 2. Less than 1% is category 3, 4, and 5. The deaths have come down to about 30 to 40 a day. As of yesterday, the 1st of April, the country has opened its borders. That means anybody can come in, but there's only one condition, that you have to be vaccinated. And they need you to do a PCR 2 days before you arrive, and you need to do a swab test 24 hours within your arrival, from the date of your arrival. So what has happened now is we have opened up our borders as of yesterday. SOPs are, except for the mandatory mask wearing, all others, like now, for example, public gatherings, weddings, dinners, there are no more restrictions. There's no such thing as only 50%, no maintaining a distance of 6 feet to 8 feet. They're all open now, which means as of yesterday, we are more or less back to normal. Saying that, when Dr. Chong was talking about dengue just now, Malaysia has very high incidence of dengue. In fact, the number of deaths from dengue are much higher than the deaths from COVID. This has been going on for many, many years. We did introduce the vaccine at one time, but they found that to have more side effects rather than being beneficial. So the government has stopped the dengue vaccine in Malaysia. So dengue is a major threat, but COVID, of course, in the last 2 years, because of the lockdown, we never saw much dengue cases. And so now I think with the normalcy in life, I think we are coming back to normal as what we were pre-COVID. In fact, the government has now made it from pandemic to endemic now. We are now in an endemic phase. So I think we have to wait and see what's happening. The cases went up to about 30,000 per day, and now it's come to 18, and I think it's reducing. It's on the downward trend. So let's hope for the best and see what happens in the future. Thank you.
Thank you. Can I invite Dr. Elvin from Hong Kong?
Thank you. Again, my best wishes to Chong, and well, you're in our press, and yeah, you look good. No more lobster. Excellent, handsome Chong, chairman. So well, excellent. Great. So the lobster's gone. Yeah, thank God. And well, of course, well, I think the experience, your personal experience, is really terrible just by imagination. So you are really tough, and I believe that when the going gets tough, the tough gets going, and you are the toughest one. Okay, and we're so happy to see you now handsome without the lobster skin. And I also like to, well, just to report to you about our situation in Hong Kong. In fact, we had just, I think, optimistically passed the peak of the Omicron BA2. All right, in Hong Kong. But the new threat is coming. So, all right, so the deaths, now the death toll had already climbed up to 7,945. So today it would pass 8,000 definitely. And more than 10,200 patients were hospitalized because of the COVID-19. And 79 were are now still in ICU. And okay, for the yesterday, the number of confirmed positive cases was 5,800. Is only now 1/10 of the peak when we had more than 58,000 confirmed positive cases a day last month. Okay, so we could not be complacent because we had already detected 2 cases of XE, the newest mutant strain that occurred in UK. Only about, I remember, 637 cases when I checked it yesterday. So we already had 2 at the border. when we had incoming residents coming back from UK, they were found to be XE positive in the middle of March. And so luckily, I suppose we had stopped it there, didn't have caused any community outbreak yet, but I really, really was worried. I am worried because the government is relaxing the rules. Well, thanks to Singapore and our neighboring places like Australia, New Zealand, Thailand, of course, and then Hong Kong seemed to have to follow a little bit, especially about our infamous tight and stringent rules for incoming citizens. And also we had closed the border strictly to 9 countries. That is, even our citizens from these 9 countries could not come back to Hong Kong in the past 2 months, okay? Now we are opening up again and to many other countries as well. So I, of course, I applaud for such opening of the borders. And yet, I think we must be very, very careful. We could not exempt, we could not provide exemption to the aircrew members or diplomatics as loosely as before. I think those are the loopholes that let these mutant strains come into Hong Kong. Every time our waves, including, of course, this 5th wave, it is because of the exemption for the aircrew members coming back to Hong Kong on the 27th of December. These aircrew members left Hong Kong as the domestic flight aircrew, but then they returned in Hong Kong as cargo flight aircrew member. And so as cargo flight aircrew member, they were exempted from the routine rules of 14 days of quarantine and testing in the designated hotels, all right? So they were allowed to have home quarantine for 3 days only, all right, for these cargo flight aircrew. They said that because this is for, well, for practical purpose, because otherwise these aircrew members just refuse to come to Hong Kong because of our stringent rules. But the fact is, just because of these aircrew members' exemption from the quarantine and testing, they were allowed to be quarantined at home. And then these 2 guys broke the rules. They refuted and went out, meet a lot of people and spread out. They were the super spreaders and caused this shameful outbreak in Hong Kong, causing 7,000 people, 7,700 already died from this outbreak, because for the 4 previous waves, we had just accumulated to have 213 deaths. And just for this 5th wave, we had already got 7,700 deaths. It's so sad for all these people and their families. And so sad that because of the overwhelmed, our health system, hospitals were all overwhelmed. So we just couldn't have beds enough for 58,000 confirmed cases a day, you can imagine. And about 200 or 300 deaths a day at the peak. So our medical staff, our nurses, they were all exhausted, burnt out. And well, that's the nightmare. So now it seems that is really the light at the end of the terminal of the tunnel. But then I'm afraid that it might not be, because with these, of course, it's good to hear about this relaxation of the rules and opening of the borders again. But with the BA2 still active in many places, such as in Japan, in Korea, now in Australia, and the research, the upsurge again of the positive cases in UK and USA, etc. I'm afraid that the sixth wave will be coming, especially with the XE, and now coming up, perhaps it might replace BA2 again. And then I think all of us should be aware of this and should not be off guard and could not be complacent. So one of the new things that we have found for this fifth wave is especially for the children. We had the study, I think many of you have perhaps already read our report on the more than 1,000 cases of pediatric cases. We found 4 deaths, which is much higher than other places and from our previous waves. So 2 of them suffer from acute necrotizing encephalitis, and 3 had died from other pneumonia, and also let me see, and of course they had concomitant long-term diseases like cancer and renal disease, Duchenne's muscular dystrophy. All right, but at least 2 had died from fulminant acute necrotizing encephalitis. I wonder whether our friends here, you have similar experiences in your own medical association practice of your own colleagues. And so it is very traumatizing for the families in Hong Kong for these casualties. And then, of course, we had succeeded in the vaccination drive. Now we are 92.5% of our population having the first dose already. All right, but of course that's not enough, because even for the second dose, it's only 84.5%. For the third dose, it is still about 40%. It's too low. So especially half of our population had got the Sinovac jab, not the BioNTech jab. So for this Sinovac jab, well, it's proven that you need 3 vaccines doses to be able to prevent the hospitalization and death of the confirmed infection by this BA2 Omicron, not to mention the XE. So we still have to work hard in pumping up the vaccination coverage, especially in the elderlies, because in the age group of 80 years of age, it's only about 55% for the first dose. And for the second dose, it's only about less than 40%. So really need to work hard here, because they are the most vulnerable patients if the 6th wave is really coming. So, so with this 5,000 a day, of course, is still very high, although it is only 1/10 of our peak in the 5th wave. But still, more than 5,000 a day is still so high, right? So I think we need to have this coming down to 3 digits, I think. Then on the 21st of April, then we could probably implement what the government had promised to relax the rules and to open up the border more. But then, and the schools will reopen to all students. All right. Thank you very much.
Thank you. Dr. Owen.
Thank you. By the way, I don't know whether our Russian colleague is in our group. That is Dr. Is that Alilua?
Yeah, I think so.
I suppose Russia is also a member of CMAAO. No, it's not. Russia is not yet our member, right?
No.
But we, of course, welcome him in the discussions.
Yeah.
Yeah.
Yeah, I think a lot of members over there are from WMA also. So.
Yes.
Can I quickly invite Dr. Jamaluddin Chaudhary from Bangladesh and then followed by Pakistan?
Yeah, thank you. I'll be very brief actually. We have spent a lot of time. Thank you so much. Bangladesh is passing good days, you can say. Daily infection is less than 100, you can say, and number of deaths actually in the last 14 days is only 11 from COVID, and the number of cases less than 2,000 in these 2 weeks. The vaccination coverage is 75% of the population or the first dose, and the second dose obtained 65% of the people, and the booster dose gave to 8.5% of the second dose receiver. So this is the vaccination situation, and the travel restrictions regarding travel restrictions to Bangladesh is similar. Only if you have the vaccination pass, that is the fully vaccinated with booster if needed, then you are allowed to enter without test. And the restrictions actually regarding the travel by air, and the airline itself gives some restrictions itself because you have to fly with others, so they put some restrictions other than the country of destination. So in the internal travel, yes, mask, you have to put on mask definitely because the government is having the restriction. Still in order it is there, but most of the people, they do not wear mask. With that order, you have this legal right to just ask somebody. Yes, if you do not put on mask, you cannot travel. You cannot go by the closed door elevators. That you have the right to say. So most of the people are not wearing masks, and everything is free. No restrictions here. Thank you so much.
Thank you so much. Can I invite Pakistan, Dr. Wazik and Dr. Ashraf, Dr. Salma?
Okay, thank you, Sarab. Life is back to normal in Pakistan. Our national health authorities have lifted all the restrictions of COVID. And however, the advisory to wear mask in crowded and closed spaces, social distancing is definitely educated. Regarding the data, we had partially vaccinated about 132 million, and fully vaccinated are 115 million, and the booster doses we had over 6 million. So the vaccination program is going fine, and the total confirmed cases we had 1.5 million, and the recovery cases 1.5 million, and the critical cases in the last 24 hours, we had none. The deaths total in Pakistan have been 30,000. And in the last 24 hours, there was only a single death. And our total testing has been 27 million. And in the last 24 hours, we had 29,000 testing, and the positivity rate is 0.6%. So things are pretty good. Everything is being opened, and no travel restrictions. These are the stats. The situation is pretty under control and very encouraging. Now, at this stage, I would like to, invite all the people on this forum for the CMAAO 2022 meeting in Karachi in September from 23rd to 25th. So please pack up your bags and be ready to be in-person meeting in September at Karachi of CMAAO 2022. We had a curtain raiser ceremony at the Pakistan Medical Association head office, and from the PMA platform, we invite all the participants on this forum for the CMAAO meeting in 2022 at Karachi in September. So that's it from Pakistan.
Thank you. Dr. Ashraf, would you like to add something?
Thank you very much, Saurabh. I just would like to congratulate and to say that I'm very much happy to see our Chairman Chong, Dr. Russell. And one thing what has happened to Chong, we have seen such cases in Pakistan too, that is the sequence after the COVID to dengue fever. And I was just chatting with Chong that the dengue is most worst than the COVID patients, and it is a suffering indeed, but I do not have the number what Pakistan has about it. But luckily the dengue was on high rise, yes, last year, but this year we have a very low number of this dengue fever. Dr. Qazi has said all about, but one thing I would like to add about is that we have abolished the NCOC, the National Command System, which was regulating all the COVID pandemic in Pakistan. So practically Pakistan has declared that nothing has to be weared, although in Punjab, where I live, the Lahore, we in the hospitals and the health establishments, we are asking for the wearing the mask. I agree with the Angelique that the restrictions which has been taken off, practically the mask, I think it is too early to declare to put off the mask, and it may create some problem in the near future. This is what is all about Pakistan. Thank you very much, Saurabh.
Thank you. Can I quickly invite Taiwan Medical Association? If you're still there, I'm sorry I missed out the name. Taiwan Medical Association, can you hear us? Please unmute. Yeah.
Yes. Thank you, Saurabh.
Thank you.
Well, compared with most of the countries, we are actually a little bit lucky than the rest of the countries. And compared with in the past few weeks, for the past week, we actually getting a little bit more cases, infection, which identified from a few different small cluster. There's a problem here because quite a few clusters, actually, they could not trace down the original, source. So it's a little bit, difficult for us now. But government actually still heading for to lose the border control and for also the regular life, So we are heading that direction. Those we are getting a little bit more. For example, yesterday we get more about 236 cases, and about 100 actually are domestic. and 130 cases actually, coming from the outside. So that is pretty much what I can tell all of you now at the moment. Is there any question about that?
No, thank you so much. Anybody else has a question? I see
Saurabh,
wonderful
simply,
kids.
I would like to appreciate and congratulate and welcome the from the Taiwan, the children of Taiwan, the scientist children of Taiwan. Thank you.
Yeah.
Thank you. Thank you.
Thank you so much. I don't think we have any more left over. So I would let the Dr. Chong to close the meeting.
Was it from Taiwan or Thailand?
Taiwan.
Taiwan. Okay.
Yeah. Well, actually, I also got a dengue fever 20 years ago when I reached Singapore.
Oh no.
That after I returned from Singapore, I had get a high fever, continuous high fever for 5 days.
Yes.
And one thing that really bothered me was because I have difficult urination. So I went to see my student in the emergency, and they did a sonogram for me, and they said there is nothing special. So but after that visit in the evening, everything went off. So I was lucky again.
So I request everyone to join the next week meeting for sure. We have a speaker from South Africa, Professor Sabir Madi, and he's an expert on vaccination, and he is bringing a lot of information behind him. So I would require everyone, your presence and the confidence, so that we can ask questions, whatever we have. And I think thanks to South Africa Medical Association for arranging it. So over to Dr. Chong. Thank you,
Saurabh, and thank you everyone for all your best wishes that for me and Dr. Russell's well-being, and thank our Taiwanese colleague for giving us the latest update. So nice to hear from Taiwan, and of course everyone who has contributed. So I think without much further ado, we have to realize that basically as COVID starts to ebb away, we mustn't forget the dual challenges of the existing communicable diseases that all been lurking and been in the background for the 2 years, and they're all coming back to roost. So dengue, your RSV, your influenza, these things will all make a comeback as we take our eye off COVID. So thank you very much again for everyone, and it was such a pleasure to listen to everyone this morning. And our thoughts and prayers again go out to Hong Kong for all the devastation that has been wreaked upon their country, upon their city-state for the last few weeks. So sad to hear all this carnage, and I hope that we can all see each other in person in September in Karachi, and look forward to seeing each other and enjoying that human company and that human relationship. Thank you all, and have a good week ahead, and I'll see you all next week for an important meeting.